weren't asked to designate a spokesperson, but we'll just do it popcorn style and see how this goes.
Okay, great. So the first picture we're going to debrief from is up here, and is the picture that was on the right-hand side. So I realize not everyone might have rotated around to it, but even if you didn't, feel free to just shout out. We're not going to go through these questions exactly, but I would just ask, like, what are things that popped out to you in terms of what might be health promoting about this atmosphere, or what things could be improved in terms of promoting health equity?
I like that they have music there to kind of draw a crowd, but at the same time, there doesn't really seem to be a crowd.
Right, yes, music, but yeah, maybe not like, why do you like the idea of the music there?
I think it just brings more people out because they may want to just come and support their friends who are playing, and then they end up learning more about the market and want to participate more.
Yeah. I mean, that is one of the abilities of like an open space like this, to be able to create environment that's not just about whatever retail is going on, but also a space that can be used in a multifaceted way. What else? What are some things that popped out to you as some challenges maybe to health equity in this photo, or could be?
This is geared towards more higher income population based on the background. The apartments are very fancy and it's very expensive, so I don't think it's geared towards like the low income.
Okay, so just in case folks didn't hear, so just this looks like it might be geared towards higher income individuals and maybe not as accessible to low income families. Just a little background, we just kind of wanted to get thoughts on this as we were thinking, but this picture is from Columbia Heights in DC, so the same farmers market that I showed the video from. And if folks, like, hands up if you've like lived in DC. Okay, so a fair amount. So if you've lived in DC, you might know this is a gentrifying area of DC. So it is, it was formerly a low-income neighborhood and now is sort of mixed income. So it's that I think what you like put your finger on. There is like a little bit of there are sort of the opportunities and challenges that come with gentrification. And there are higher income clients around there, although there is protected affordable housing around there, so it's a little bit of a mix. And they do have matching programs for WIC and SNAP, so they are trying to make that food access more equitable, but that is still definitely a thread throughout it. What else? Yeah.
Street access.
Street access.
Transportation, how do you get there? I mean, it could be that I just don't have an aerial view.
Yes. No, for next year, provide aerial view. Yes, yeah. But what does like street access look like? Yeah, so this is located like a few blocks away from Metro, and there is a bus stop there. But I think that is like a very like a valid concern about how people are getting to retail environments that might be health promoting. What else? Yes, Ellen.
I think that in the video they said that formerly there wasn't a supermarket within 5 miles. Now there's a giant, like literally across the street from the farmers market. There is a supermarket across the street from this farm. Inside knowledge there, thank you. There is a supermarket across the street, which that may or may not be health promoting. There's different like advantages and disadvantages of that. Other thoughts before I move on to the next photo? Okay, so the second photo, I think that's the one in the corner there, right? So folks that chatted about this, what were some things that you identified as being like health promoting about this photo? You're like shaking your head now.
The presence of, fruits and starch there.
Mm-hmm.
Having them present at all, like a corner store.
Right. Okay, so sort of having fruits available, and then you mean like the potatoes and the In the corner, yeah, mm-hmm. It's being all promoted. What else? Yeah.
Someone mentioned in our group the ratio of processed food compared to the fresh produce and vegetables, and how that could be limiting not only in availability but also just like the benefits to your diet and health.
Yeah. So, right, so that you mean it might be like the processed food might be inhibiting sort of the fruit and vegetable in front of it, is that what?
It's just like you don't have that much access to, like there's not that much variety with the fresh produce and vegetable. Like there's more of the processed food on the shelves compared to what's fresh at the bottom.
Yeah. And we can't see here, but it'd also be interesting to know like what the prices of those fruits and vegetables are, because those of you that have worked in corner store retail might know that sometimes just getting that fresh fruits and vegetables and keeping them fresh is expensive to maintain. I saw a hand back there also. Was there one?
Oh,
Yeah,
I was
you.
gonna say, I'm curious what the cost is,
Oh.
because, I mean, I doubt a box of Fruity Pebbles are more than $1.50, but that's probably what, one apple.
Yeah. Yeah, so I think that's an important element to keep in mind is when we are trying to make changes to the built environment, not only is what are we doing to intervene, but what else is happening around there, because these things don't happen in isolation, right? They're happening in conjunction with people's retail experiences. Yes. Yes.
I think I'd be curious to know how long those fruits and vegetables have been there, regardless of the price. And also for me, I'm trained to, they're less desirable if they're not in a cold section sometimes for some people.
Yeah,
So.
yeah. And that also may or may not be a mental cue to somebody that food is of a better quality, whether it is or not. I think those the cues of how the retail environment is set up are really important as well. Any other thoughts?
Next photo is this one. So what are some of the things that stood out in this photo to you all?
The E6
So yeah, the E6 right here, right near the candy. What else?
the water is inaccessible in terms of there being a barrier.
Right. So this makes us think about, yeah, we have a healthier product, but can we even access it? Like if I'm a customer and I'm right here paying, I'm much more likely to reach for these open Skittles than these closed cases of water.
Those are placed where you pay. They're placed there as kind of a last minute grab. Oh, I'm also going to get this.
Yeah. So even thinking about in the retail environment or the built environment, impulse purchases, where things are placed really has and can shape the things that we buy, the things that we consume, and so forth. Yeah.
If someone comes in and they have a child with them, it's the first thing that they're gonna see because it's right there at eye level.
Right.
It's colorful.
Right.
Again,
Yeah. Why do you guys think in supermarkets there's like the checkout lane and you're sitting there in the checkout lane, you have candy and gum and brownies or whatever else is right there. It's those impulse purchases, right? And there are things which we can get into later as far as in the retail environment called slotting fees. So manufacturers or producers are paying for the space in the retail environment to promote their product. The cigarette companies pay for this space to be right here at the point of sale. And there are research studies that show in the case of tobacco with now junk food close behind it, both have a lot of dollars that they have pushed towards the retail environment to have prime placement to get people to buy their products. So marketing works, placement works, and so forth. What else about this photo? Okay, let's move to the next one. Oh, there we go. So now we're kind of on the outside of a retail environment. What questions or things came up for you all looking at this photo?
I personally just assumed it was in a
low income area. Well, I'm a tobacco inspector, so and I mean, yeah, I just looked at it and I was like, yeah, that's a low income. Of course, the milk egg bread for EBT, and then the tobacco sign, like that picture just set it off.
What else?
Yes, prices for cigarettes.
The three?
Yeah,
Oh, yeah.
so that's really inexpensive. It's really cheap compared to, I don't, other states, I don't know what this is based in, but,
Right.
right, yeah.
So thinking about the advertisements that we see that may invite us into a store, or even more broadly, you may look at the sidewalk. I don't know if anyone said, oh, the sidewalk's not very manicured or cleaned or taken care of, so, yeah.
We talked about the fact that there was a sidewalk, which
Yes.
is better than nothing.
Yes.
But we also wondered about that street and the crosswalks and kind of what the risks were in getting here.
Oh, yeah.
And then we noticed there wasn't a bike rack or anything like that if you wanted to come by bike.
Yeah.
I was wondering like how close it is to a school since the kids both have their backpacks and.
Right. So thinking about where it is in proximity to other things. I saw a comment back here, and I'll get to you, that someone wrote, what if this is the only store in the area? What kinds of products are in the store? Do they only have junk food, sodas, and so forth, or do they have other more health-promoting products inside? Yeah.
Yeah, the store generally is just really eye-catching and really draws you in, like having the doorway facing an intersection like that, and it's a nice big opening, and it's a really unique building. I feel like it's probably the known place.
Right. So is that based on the color and?
Yeah, the color and like all the stuff going on, like the molding at the top, like it's an interesting store.
Right. So we've talked about the products in the store, we talked about the marketing and the frontages on the outside of the store, but even thinking about the colors of things, the structure of things, where they are in proximity to other things. All of this really matters when we're thinking about the built environment and how it promotes or detracts from health. So that's it for Tim.
Okay. And just to take a pause, I think you all, none of these pictures are intentionally sexy, they're not professional, but hopefully everyone can identify them in their day-to-day life, where you drive, where you live, and that's by design that we did that. And also, we were really thinking about photos that aren't necessarily good or bad. There's not necessarily a value judgment, or there's pieces of both, right? So hopefully this got some of those juices flowing. So those who looked at this photo, what stuck out to you? What struck you right away? A community garden? Yep. What feelings did you have? Would you want to live there? Yes? No? Yeah. Why yes? This.
Apartments look nice. Garden. People come together for a call.
Yes. You.
The only thing that doesn't look nice is it's right next to a highway.
And because of that, that this is not a place where upper middle class people are upper class live. This is a
Interesting.
new housing development, it's probably for low or.
So this is actually public housing in Birmingham, Alabama. So this is Jones Valley Urban Farm, right in the heart. So being near the interstate means lower income. How's that work, right? Why do we do that? How'd that happen over the years? That's a whole nother conversation. Redlining and everything else, but in present day, what that does for air quality, what that does for noise pollution, safety, access to similar amenities on the other side of the highway? How do you get there? Does that look safe to walk under that? So all these questions, right?
And you mentioned light pollution too, so
Light
if you're trying to
pollution.
sleep, you have all that noise and light and whatnot.
Yeah, highways don't close in the evening. It's true. Anything else on this photo before we move to the next?
It looks like there is a sense of community and people coming together and lots of nice
Great, yeah.
activity outside.
What about this one? Would you want to live near this? Yeah.
I'd want to live there if they put a crosswalk.
Okay. So for you, literally paint on the ground and you're moving there. It's funny, I mean, that's in jest, but think of the investment that a community can make, relatively cheap, to then do something to attract homeowners, make it look more appealing, whatever the case. I think gentrification is certainly a common theme throughout all of this, in terms of thinking about when you build infrastructure that is more amenities that are health promoting. What does that do to the community that's there? What does that do to the community that sometimes outsiders or even others are trying to help or give access to all of a sudden? So, big questions for sure. And what else is going on in this one that you're thinking about?
When I looked at this picture, my immediate thought was who can use this part and where is it? If you look closer there, it looks like maybe some community centers in the back, but on the right side, it looks like larger homes. They could be condos, they may not be, but just thinking who lives in this environment and who has access, if it is public, and if it is public to anyone, how can you get here?
Good. What are some good things going on in this photo? Yes.
It looks relatively new, very well lit, it's clean, well taken care of, and those are all very inviting aspects.
Yeah, so both the lighting, I'm glad you called that out, and the tree. So depending, when we talk, this one over here talks about multi-generational, that flip chart, I'm not pointing at a person and calling them this one. It talks about multi-generational and keeping that in mind, right? Thinking about accessibility for people of all abilities, all ages as well. So depending on where this is, if it's really hot, having the opportunity for shade, and then also the lighting for safety in the evening time, and right next to the sidewalk. Yes?
I was going to add something as well. I like that there's a ramp in the entry, so that makes me feel like it's accessible to people with disabilities, which is not always true in spaces, like active spaces.
Mm-hmm. It does raise some questions where they're coming from, though.
Well, I actually was wondering if I see a little bit of white next to that. I don't know if there actually is a crosswalk that we can't see because of the shade, but I don't know.
Okay, and then the last one, and then we'll use some of our time to really talk more about the common themes and really thinking about how this stuff happens. But before we get to that, what about this one? Would you want to live in this community if you're looking to move? Just based on how it looks. I know there's so much more to making those decisions, but
I always feel uncomfortable driving on the road when there are cars parked there all the time because, you have less space to drive and I'm worried about pedestrians who might be crossing. And the sidewalks aren't bad, but still I would like to see more grass on the side closest to the road so that there's a little more of a barrier in between my car and pedestrians.
yes.
There's also lots of curb cuts where if you were like trying to walk or jog or push a baby stroller, it would be dicey on that sidewalk and it's pretty narrow.
Yes.
The yard space was limited, so if you think about children, as she was saying, pushing a baby or something like that, and taking a kid for a walk. I don't know if this is, it looks kind of like the backyard on this side right here, but I mean, if you think about for the purpose of being outside of the it's like, obviously it's talking about traffic coming through the parking car, so it's probably not the safest area. We're playing basketball, we're getting softball, something easily goes into the street, you know, there's a danger right there.
That was exactly my point. Like if I was one of these houses and had kids, I wouldn't feel super safe letting my kids go outside to play without me. So I probably want them inside, which would be less expensive.
So here's a question. What, how fast are you driving down this road?
Too wide.
Yep.
That road is way too wide for a residential street, so people are gonna go.
And it's very straight.
Yeah.
So I did not get my planning degree, but that question is all you need to ask people, right? Like, actually, in the back, I don't know how to get that pointer, but it says 25 miles per hour. But how fast can you? It's basically how fast can you drive, and that's the speed limit, right? So I love this picture because there's so much going on. I mean, if you were to be someone in this community's planning department, you'd say, oh, we got sidewalks there, check, we're done, we got it. So people can do it, but strollers, people with mobility issues, runners, that's just a broken ankle at every single curb cut, right? Thinking about children, and then you've got a pole right in the middle of and there's a lot of opportunity though when it comes to transportation here and design around making this